I'm Rose and this is Caris. Caris is, how old are you, Caris?
7.
Okay, I won't tell you how old I am. So Caris was born with spina bifida and hydrocephalus. So basically what that means is that the spine is kind of cut at the bottom, and everything below that, nerve supply wise, doesn't work as well as it should. So some children with spina bifida can have trouble walking, and some children can have trouble with having a wee or having a poo, depending at what level the spinal cord is actually cut. So Caris is quite lucky really, because it was quite low down. If it's high up, it can be more severe and it can affect all sorts of things like breathing and other problems. But Caris was very lucky that it was quite low down. Because the nerve supply to the bladder doesn't work so well, Caris doesn't empty all of the wee out of her bladder, so there's a little bit of wee left, and then that can cause infections and things. So for that reason, when she was about 6 weeks old, we were told that we would have to catheterise Caris. Obviously we were a bit nervous at first, because it is nerve-wracking when you've got a 6-week-old baby anyway, but to be sort of doing things like catheters and things was a bit nerve-wracking at first. Caris was a very good patient. Well, she used to kick me sometimes, but she was pretty good most of the time. We started doing it, and we did it about 5 or 6 times every day, sometimes more, sometimes up to 8 times in the first year that she was born, because she had a lot of urinary tract infections. Because we'd tried various different catheters in the first year, and she was getting a lot of wee infections, and a couple of the times with one of the wee infections that she had, she was quite ill, and it affected her kidney on the one side, so it caused some damage to her right kidney, but her left kidney is absolutely fine, and that's normal, luckily. So the whole name of the game really below the age of 5 was to reduce these risks of getting recurrent infections. So when she was about 1, after a spate of lots of infections, luckily we were introduced to this product called Antibac catheters. They're very easy to open. You can do it yourself, can't you?
Yeah.
And all you have to do is, you're always going to catheterise where you've got water anyway, because you wouldn't ever do, because you've got to wash your hands before you catheterise. So all you need for the Antibac to activate the coating is water. So I find that really easy. So you just fill in with water, we leave in for 30 seconds, you don't have to count anymore, and it's good to go then. So I find it really easy to use. When it goes in, it's just easy to go in, it just glides in. There's never been any trauma done or anything like that, because some of the other catheters because it's not just me that catheterises Caris. When she was younger, obviously when she was in school, she'd have like a one-to-one that would catheterise her in school, and when they've tried other catheters, sometimes you can have like a bit of trauma and a bit of blood then when you do it, and things like that. I've never had anything like that with Antibac. It just glides straight in, really easy to use, and I think that's all down to the coating, and then the coating also reduces the risk of infections, so it's like a double benefit really. She started using them when she was 1, and I wouldn't use anything else now. In the 6 years that she's been using them, there's been a massive reduction in, well, I can't remember the last time she had an infection in her wee. Fantastic! What would you use?
Brilliant.
See, because she's had a reduction in UTIs, in water infections, that's a massive relief to us in terms of she's got one normal functioning kidney, and that's remained normal and functioning, and obviously that's life-saving. So it's not just quality of life, but that's life-saving.